So as we prepare for birth physically with our prenatal fitness programming, you may think that I need to do lots of squats as deep as possible to prepare my hips, to open my pelvic floor for birth. And while external rotation of the femurs or from these deep squat positions are helpful because it is opening one portion of the pelvis, we also want to focus on ensuring that we can open the bottom of the pelvis as well with internal rotation of the femurs. Typically throughout pregnancy, we tend to favor this more externally rotated position. So toes are pointed outwards and we tend to kind of fall forward in this more extended position. And so this is going to help support our spine position and to find our comfort throughout pregnancy. But because the pelvis tends to be more closed in the bottom of the pelvis and it tends to be less of a movement pattern that we can achieve, we may find during labor that finding internal rotation is more challenging and it could contribute towards a labor stall. So throughout our prenatal programming, we also want to focus on being able to find that internal rotation of the femur, and we can do this with a number of positions. The first movement that we can do to find internal rotation of the femurs to prepare for birth is step-ups. So you'll find an elevated surface roughly 12 to 18 inches, and you'll place one foot onto the box. And so where we want to find internal rotation is at the bottom of the movement, when the muscles are most stretched. And so in this position, my glute muscle here is in a more stretched position. And so what I want to think is my ankle is going to stay stacked underneath my knee as I bring my belly to my thigh. And so this is achieving internal rotation. The hip angle at my femur to my pelvis is less than 90 degrees. In this position, I'm feeling more of a stretch here in my glute. And then I'm really focusing on keeping my knee stacked over my ankle and keeping weight into the big toe side of my foot. From here, I can almost think reach forward as I shift weight into this leg. I'm really feeling this hamstring and glute loading at this point. And then I'm going to exhale to lift in that pelvic floor as I stand up and then facing forward. And so sometimes this movement gets a little bit confusing because the torso is shifting with the legs. So as I lower down, I'm going to think reach forward to find that belly to thigh position to emphasize that internal rotation. I'm feeling this stretch here in this hamstring and glute. Load that leg, exhale to face forward, and then inhale to lower down as I come back into internal rotation. So this reaching portion can be really helpful to help you find that internal rotation. So you're almost like trying to reach for the wall in front of you that is more aligned with this knee. Now you may find that belly starts to get in the way throughout pregnancy, so lowering to a smaller box can usually be pretty helpful as opposed to having a box that's really high. The next movement that we can do to try to learn how to find internal rotation and then also incorporate into our prenatal fitness programming is going to be a reverse lunge with a banded row. The banded row is going to add the lat into this and it's going to help with that reach portion. So my opposite leg of the arm that's holding onto the band is going to be my stationary leg and the leg that I'm focusing on finding internal rotation. So I'm going to inhale to step back into the bottom lunge as I reach forward. So really similar to that step up. I'm reaching forward and this is helping to bring me into that internal rotation. So my pelvis is closer to my femur. So I have this closed hip position. Knee is stacked over the ankle. I'm thinking weight into that big toe, so I'm not allowing this knee to shift outwards. And then I'm feeling this big stretch here in this hamstring and in this glute. So I'm reaching forward here, and I'm gonna exhale to bring the hips forward as I row that band back at the same time. So inhale to reach forward as I lower down, finding that internal rotation. Think weight in the big toe side, knee staying stacked over the ankle, and then I'm finding a bigger stretch here in this glute. Are all gonna be clues that I'm finding that internal rotation. And then exhale to come on up. So the reverse lunge row is a really great exercise to do, especially if you're having any sort of pelvic girdle pain, but it's gonna really emphasize that internal rotation emphasis of the glute to help you open the bottom of the pelvis more. Another exercise that we can do will be the staggered stance Romanian deadlift. And we can either do this with the band, similar to the reverse lunge row, which can be really helpful if you need to maintain a more upright position, or we can do it with weight if you're finding that leaning forward still feels good for you. So with the weight, I'm gonna hold it in the opposite hand of my working leg. And similar to the other movements, I'm going to reach forward or towards the floor with the weight, and I'm trying to bring it towards this foot. So most of the weight is gonna be in this front leg. Similar setup, I'm keeping weight in the big toe side of my foot, ankle and knee are remaining aligned with one another, and then I'm finding this big stretch here in this glute and hamstring. The difference between this movement versus the reverse lunge and the step ups is that I am more of a hinge type motion. So if I had a flashlight attached to my butt, shining the wall behind me, as opposed to a lunge where it's shining the floor below me. So I'm here, it's gonna be a lot more of a hamstring emphasis. Sometimes bringing that same side arm back to really think like open the torso towards that leg can help find that internal rotation. And then exhale, come on up. So really keeping weight in this foot. I'm gonna inhale to lower down. Think big toe, ankle, knee are aligned with one another. And then exhale to come on up. Now, as belly gets bigger, doing it with the weight may be less comfortable, and so we can regress back to using a band, which is gonna allow us to be a lot more upright. So I'm in that same setup here. I'm thinking hips towards the wall behind me, and then exhale to come on up. So the hips are a lot higher than they were with a reverse lunge, but we're still emphasizing more of that hamstring and glute lengthening with the Stagger stance Romanian deadlift. Ways that we can emphasize this internal rotation is we can use external props to help us feel it within our body. So if you're doing the step ups and the lunges and the staggered stance, and you're just like not quite feeling it, sometimes using a foam roller or a band can be some helpful ways to feel it. So I'm gonna take this foam roller, you can push it into a wall. Here I'm using a squat rack, and then I'm gonna place it so that's the inside of my knee. So now I'm gonna actively press the knee into this foam roller as I find those different hip positions. So if in my staggered stance, I'm gonna think bring my hand towards that opposite foot. As I think twist my pelvis or bring my belly to my thigh. So I'm actively pressing here. This is gonna force me to maintain that stacked position with my big toe, ankle, and knee. And then I'm gonna think reach my hand towards that foot to feel that big stretch in the hamstring and glute. And then exhale, come on up. So I'm gonna inhale to lower down to feel that stretch, actively pressing this knee in, and then exhale to come on up. So that can be one way to feel more of that internal rotation if you're having a hard time feeling it in these open chain positions. The next thing that we can do is we can take a band. So with the band, I have it attached to the squat rack here. You can use it with a door ankle with your door. And I'm going to attach it to the band or to my leg so it's pulling my leg towards that point of attachment. And here I have a little bit more freedom of movement because I'm not holding on to a foam roller. And so this can be great for doing like squats or the reverse lunges where the legs are moving a lot more. And so from here, I'm gonna step back. I have this band putting on some active resistance against this leg. So if I relax my leg, it would fall towards that point of attachment. So I'm focusing on keeping that big toe, ankle, and knee aligned with one another. As I step back into my lunge, I'm thinking belly towards thigh, and then exhale, coming on up. So keeping weight in that leg, stepping back to find that internal rotation, and then exhale to come on up. So that can be another way to add an external prop to help you feel internal rotation with your movements if you're having a harder time feeling it without something pushing against the legs for you. So as we prepare for birth with our fitness training, we need to do more than just movements that emphasize external rotation and extension. And so while squats and deadlifts are all great movements to help prepare for birth, we also want to focus on things that are going to emphasize the internal rotation to open the bottom half of the pelvis, particularly internal rotation that is one-sided. So you can see when I find internal rotation on one leg, it's really creating a lot of space asymmetrically in the bottom of the pelvis. And this is typically where we're going to see more labor stalls due to inability to open or move the pelvis. So movements that emphasize internal rotation, especially on one side, such as the Stagger stance Romanian deadlift, lunges, or step-ups, are going to help us train our body to be able to find this opening within our pelvis to support our birth.